Hey guys, we're going to talk about blood administration process today. We're going to go over the process in Bridge. First, you'd want to make sure that you have your consent. The consent needs to be filled out completely. You want to make sure that you have the physician, the proper diagnosis, and that you do not limit yourself. Make sure you put blood or blood products, have the patient initial, write C above, and then the physician can either sign or you can print their name at the bottom. You have to fill out the back completely. Make sure that you have the patient's signature and print name, the date fully and the time, and you also have to do AM or PM, whether you're in military time or not. You as the nurse would be the witness, and then make sure that you do the address completely as well. After that, you want to make sure that you send off for your blood requisition. After that, you would receive your blood product, which would look like this. On your blood product, you're going to get 3 sheets. Your product administration cheat sheet, your patient education, and your transfusion tag. Transfusion tag must remain on the blood product the entire administration time. The education does not get removed until you give education to the patient, and then you want to go ahead and use this cheat sheet throughout the administration process. And then now we're going to go ahead and go over the process in Bridge.
Hi everyone, we're going to do the blood administration process in Bridge. When you log into Bridge, you should land on this screen. If it asks you to log in with credentials, call 4040 because we need to fix you from the HIS side. Okay, so to start with, we're always going to scan our patient's armband. Your patient is going to come up. You're going to be able to verify that this is the correct patient, so just double check that all of your data is correct before you start proceeding. From here, we're going to today do the standard transfusion, so we're going to click the Start Transfusion button. The first thing we're always going to do is do this checklist. Remember that in Cerner, everything with an asterisk is required. Okay, so we have a transfusion order. As Stephanie showed you, we have our informed consent. The question is whether or not you had pre-medications to give. So if the answer is yes, you're going to refer anyone asking to go to the MAR to review that. You're going to select your IV site. We always want to make sure we've given our education, and we always use filtered tubing, so check that because that's correct. And then you're going to hit the continue button. The next screen is going to require you to scan your tag from blood bank. So this is your tag from blood bank. It's going to have that Aztec symbol on it right here. You're going to scan that. Your data is going to populate. It will match your patient up above. You'll hit continue. All right, we have scanned our blood tag from blood bank, so now we are going to look at our unit of blood. We've taught you that you're going to scan this in a U shape, so that would be like this. If your practice is to have this primed and on your pump, your blood would hang this way. You would still scan those same ones in the same order, okay? I'm gonna lay this down the way that we've shown you, and we're gonna scan the U. As we scan, it's going to move you through the products on your screen as well. All right. This takes me to my pre-transfusion vital signs. If for some reason you took them 10 minutes ago, you can always come and change that time so it matches when you actually perform those. I'm going to enter my vital signs. For everyone who has struggled with having to hit that continue button twice, if you hit tab off the oxygen saturation, it's going to put your cursor on the comment line. As long as you click in here, all you have to do is hit continue one time. From here, you are going to select start. When you are ready to connect that patient, the blood is going to start hitting your patient. This is the information that in real time will transfer into the chart. It will be found in results review.
All right, guys, so at this point, you've started the transfusion with your patient and you have been in the room for the first 15 minutes. This is mandatory. For every transfusion that you're going to give your patient, even if you're giving them 4 in a row, you're going to stay with your patient the first 15 minutes of each blood product. Now, Colleen's going to show you how to record those vitals.
So you're going to click on record vital signs. It's going to tell you that your vital signs are due. You're always able to enter vital signs at any time during the process, even if it's before the next time is due. The nice thing is going to be that your vital signs, the last ones you took, are going to be down below. So you always have a reference of the ones prior. So I'm going to say my patient is starting to spike a slight fever. Their heart rate is slightly elevated. We might want to look at what's going on. We're going to click into that comments box and hit confirm. It's going to take you back to the main screen again, and you'll continue throughout your process. The next time the vital signs are due, that box will have that yellow triangle again and tell you that vital signs are due again. All right, at this point, your blood transfusion is complete. So we're going to go ahead and end our transfusion. We always want to make sure that you end every transfusion. That drops our charges, so we want to make sure that we complete it. It also is going to give the data to the physician about things like the volume that we're going to look at. So we're going to hit end transfusion. The information about your transfusion that's currently running is going to be right down here, so you can always double check in case you're picking that up from someone else. But we're going to scan the same first 2 items that we scanned to begin our transfusion. So we start closest to the line going to the patient, and then we go up towards the top of the bag. So I will scan. All right. So now it's going to ask me for the volume transfused. On your blood bank tag is going to list a product volume of 500. Blood bank unfortunately cannot change that number to match what's actually in your bag of blood. Generally, the volume is about 345 milliliters. You'll be able to use your pump to validate that the amount transfused matches what you're going to enter in the computer. If for some reason you're going to stop the transfusion before you complete it, you'll be able to use your pump to validate that. So for today, we'll say we gave 300 milliliters based on what my pump reads. I am also going to say that my patient did have a transfusion reaction today, so I can show you that. And we're going to hit the continue button. What's going to come up to me is a list of every potential reaction that could happen for our patient. It's going to go on for quite a long amount of time. It is alphabetical, that's helpful. And you will see at the bottom, you have the option for others. So if your patient has some strange reaction that is not typical, you can type in there that my patient turned blue with yellow polka dots, and you can put that in the comment section. For today, I'm going to say I had some tachycardia and a rash. And then I can hit the continue button. It's going to ask me for vital signs. These are your immediate transfusion vital signs. You can see the ones I did before that are going to be listed down below. So we'll go ahead and enter some data for this patient. Okay. And then we'll hit continue. The last item that's going to come up is a transfusion reaction checklist. So we know a lot of times, thank goodness, we don't have transfusion reactions. Let's knock on wood. So this gives us a checklist and a way for you to double check that you don't miss any information. Every one of these is required. So you're going to stop the transfusion, maintain access, compare your patient and the unit information, call your doctor, call blood bank, do any orders, document all of the reaction symptoms, and you're going to deliver all that blood unit and the tubing to blood bank, and then you'll hit continue. And then this information will transmit into Cerner. It will be in results review, and all of this data will be available for any provider of care to look at.